Hi there. My name is Nguyen, and I am from the B1 and B2 Patient Care Health class. And today I will be talking about osteosarcoma cancer. Let me start off about talking about patient care class with Mrs. Dunlap. Every day when I wake up on B days, I always get to see Mrs. Dunlap first. I wanted to thank you for teaching me for my first two cycles as a junior at DeBakey. I really liked how AES taught me to interact with patients and how to take vital signs, and many other things. I want to become an orthopedic surgeon and go into sports medicine, so I really loved how this class taught me to interact with patients. I definitely needed this experience to help me out in the future for medical school and college. I will eventually pursue a job that will make me go into a hospital setting, which this class is so perfect for. First, let me talk about the osteosarcoma movie. I'm interested in this topic because I recently watched a Disney Plus movie called Clouds that was based on a real story. This movie showed how a high school student had osteosarcoma that did not have much time to live. This really hit me as people in the world do have osteosarcoma and that there is no 100% cure for this disease, but many treatments. When I grow up, I might be very interested in trying to find a cure for this disease, as it is very deadly. What is osteosarcoma? Osteosarcoma is one of the most common types of cancer. This cancer starts in the bones, and the cancer cells take the form of the bone cells that help make the new tissues of the bone. The cancer is most often found in the wide bones, such as the femur and the tibia. This makes the new bones weak, which causes the loss of strength in posture and structure. Osteosarcoma usually occurs in teens, but anyone can be affected. Here is the bone tumor, and you can see the bone cells are like getting eaten up by the cancer. That's why it's like deteriorating. This is the femur right here, and this is the tibia. What are the symptoms of osteosarcoma? The symptoms of osteosarcoma are pains, swellings, decreased motions in joints, and minor fractures that do not happen often. The symptoms of osteosarcoma may appear weeks or months before the diagnosis is made. Okay, and then these two pictures show the pains and swellings in the joints and how it can very badly affect the person who has the pain. How common is osteosarcoma? This disease is very common in children and young adults, typically after the age of 10. It occurs slightly more in males than females. African American children have a higher risk of developing osteosarcoma more than others. Genetics can play a role in certain genes, as 5% of children with osteosarcoma carry mutations with them in their lifetime. Survival rates and how to treat osteosarcoma. The survival rates of osteosarcoma are generally high, as it is 70 to 75% survival rate. But if the cancer has reached the lungs, there is only a 30% survival rate. A diagnosis of osteosarcoma can be made from blood tests, x-rays, CT scans, and biopsies. Treatments for osteosarcoma are chemotherapy and surgery, as they can help prevent the return of those cancer cells. Chemo uses powerful medicines to kill the cancer cells and to stop them from growing and dividing to make more cancer cells. And this lady right here is going through chemotherapy, as you can tell by this thing that she's wearing on her head, because she does not have any more hair because of chemotherapy. And these are my references: www.cancer.org and then www.stjude.org. Both of these websites talked about osteosarcoma and everything that was in this